Hi everybody, my name is Jemima Katama. I'm the lead infection control coordinator in Kenyatta National Hospital. I'm also the secretary for the Infection Control Nurses Chapter Kenya and one of the founder members of IPNET Kenya, which is Infection Prevention and Control Network Kenya. All these associations or bodies deal with the prevention of infection control. I'm going to talk about infection control in a healthcare setting. I'll start with the historic evolution of IPC. IPC is Infection Prevention and Control. Background information, structures for management and coordination of IPC, definition of infection prevention and control, and healthcare associated infections. Then I'll talk about modes of disease transmission, standard precautions, and risk of hospital-acquired infections. The first thing required in a hospital is that should do no harm to the sick person. Historically, we know about Ignatius Semwes, who came with the infection control precautions, and he observed that while delivering babies, the mothers were at risk of getting puerperal psychosis. So he introduced washing of hands using chlorine, and he managed to reduce the mortality from 18% to 3% just by washing the hands with chlorine solution. I cannot overemphasize the input of Florence Nightingale, who was the founder of nursing. He noted that the importance of sanitation in an hospital can prevent post-operative complications. Also, Joseph Lister introduced the first antiseptic in 1867. This was also in the line of infection prevention and control. We know that William introduced the glove in 1980 as they were all finding issues of preventing infection, and this was geared towards the best practice. The first antibiotic was found in 1930s, which was a sulfonamide. This was to combat the infections, and infection control peaked even with the time the first Society for Healthcare Epidemiology was formed by one called Reusable, and there was also applied epidemiology and techniques in infection prevention and control. Bacteria like multi-drug resistant organism, which is a methicillin staphylococcus, was discovered in 1981. That is a bit recent. This was still in the part of microbiology, because microbiology is part of infection control. In 1990s, there was expanded role of IPC or infection control to non-critical settings, because there before infection control was more insisted on the infectious disease units or patients on isolation. So it was expanded to other acute care settings. This was to improve the quality of care for all patients admitted in hospitals. I'm going to talk about the background of infection control, and I'll say that hospital-acquired infections continue to be a major concern for the healthcare industry. At a time like this, when we have COVID, it's a concern for all healthcare industries. Hospital-acquired infections can be prevented by healthcare workers if they adhere to specific guidelines as they take care of their patients. Hospitals are required to constitute committees, establish programs which are going to give guidelines for prevention of hospital-acquired infections and guide the other healthcare workers to prevent infection. I want to tell you that a small proportion of patients come to the hospital while carrying infections. But WHO says that these infections can be prevented by adhering to infection control practices such that they don't transmit to other patients. The patients who come to us also, they can carry some infections from the hospital if we don't also adhere to infection control precautions. So healthcare settings, patient demographic and advancement in medical and surgical science will dictate the kind of infection control program one should put in place. So the healthcare facility administrator, that is the CEO, the manager, is very key when it comes to infection control, because this is the person who ensures that infection control program is put in place and the infrastructure is founded. The importance of the manager or the CEO being involved in infection control is to provide funds and also resources for infection control program. Infection control program puts together various activities and practices which, when used appropriately, they restrict the spread of infections. Bleach to these infection control practices will facilitate transmission of infections to healthcare workers, to the patient, and even to the community around there. So it's important for all healthcare workers, the patients and the family members, friends and close contact to adhere to infection control guidelines strictly. I want to talk about coordination and management of infection control in our country. We have the national level, whereby we have the National Infection Control Advisory Committee, and we also have the National IPC Technical Working Group, which makes the regulation, the guidelines and disseminate them to the lower facilities. And then we also have the Ministry of Health IPC program. At the county levels, we have the County IPC Committee, the Sub-County and County Coordinator, hospital IPC committees at the hospital level or at the facility level. And in each facility level now, we have the IPC vocal person who implements, trains the IPC guidelines to the healthcare workers. I want to define infection prevention and control. This is very important because many other times people confuse infection control with public health, but both augment each other. So infection prevention and control is a scientific approach and practical solution designed to prevent transmission of infection to patients, healthcare workers, and the community. It is grounded in infectious disease, epidemiology, social science, and health system strengthening. That is by WHO. Then what is the definition for healthcare-associated infections? These are infections that are inherent on admission and that appear 48 hours post-admission or within 30 days after discharge. They are acquired during the delivery of healthcare services or while visiting the hospital or the healthcare setting or while receiving the treatment. Objectives of infection prevention and control. 1, it can help us stop the spread of infection, thus assisting the healthcare workers in provision of quality healthcare. One cannot claim to provide quality healthcare if a patient comes and gets an hospital-acquired infection. It will also prevent post-procedure infections to clients, reduce the risk of healthcare workers acquiring infections, protect the community from the infections which may occur from the healthcare facility. It always lowers the cost of healthcare services, both to the patient and also to the hospital and to the family. We have pillars of infection control, and I will tell you administrative support comes number 1. The administrator is key when it comes to infection control. We have engineering and environmental controls, protective controls, training, research, and surveillance. What are the causative organism causes infection? Because we have to know what causes infection so that you may be knowing how to prevent it. We have bacteria, viruses, fungus, parasites. These are the major ones. So we need to know whether it's a fungus or it's a bacteria or a virus because the treatment or the elimination for each is different. The same way you treat a bacterial infection, it's not the same way you treat a viral infection. There are 2 things as healthcare workers or healthcare professionals we need to know if we are going to prevent infection. 2 things. The various ways an infection can be transmitted. You need to know how is it transmitted so that you can cut the chain of infection. The ways of cutting the chain or breaking the chain of infection is the second thing. So the modes of transmission, we have airborne. And when we say airborne, we mean that the spread of the microbes, they are in a small droplet nuclei on the air, less than 5 microns. It remains in the air, suspended for a longer time. The weight is less. When it comes to droplet, like the case of COVID, the droplets are larger particles, more than 5 microns. They can be transmitted from 1 to 3 feet in the air. They are usually generated through coughing, sneezing, talking, laughing, singing, and during aerosol generating procedures in the hospital. So the difference between airborne and the droplet is the size of the microorganism and the water molecule around it. That is about the weight. Conduct, route of transmission, is the transfer of microorganism through touch or coming to contact with the surfaces. There's also indirect transfer through the contaminated surfaces, object. When we talk about mode of transmission through vehicle route, is the materials that serve like a mode of transmission, like food, water, air, if it's contaminated. Vector mode of transmission, it's the microorganism is carried by a pathogen like a mosquito, a flea, and then an infection occurs. I want to talk about the risk factors of hospital-acquired infection. One is iatrogenic factor, whereby it is about the procedures the patient is done in the hospital. The invasive procedures which pierce the natural body protection, the skin, like the catheterization, intubation, fascicular lines, all that, and then the use of antibiotic and misuse of antibiotics. The second one is organizational factors, whereby we are talking about contaminated water, physical areas, poor hand hygiene, staff ratios, and all that. Then we have those patient-related factors. That is the underlying medical condition, the compromised patients who have stayed in the hospital for a long stay. Those are the patient-related factors. Now, for us to cut the chain of infection, we have to understand it. It has 6 links: the infectious agent or the source, whereby we have the bacteria, the virus, and the parasite. The reservoir area, where the bacteria or the virus or the organism will grow, survive, multiply, and start now moving from there to infect the next victim. Then we have the port of exit, is how the microorganism will leave the body to the next person. It's through our body system again, either the respiratory system, the skin, and all that. The means of transport or the transmission is through our hands, the airborne, the droplet, as we had said in the previous slide. The port of entry, again, is through our body, through the systems. Could be respiratory, could be through the skin if it's a wound, during operation, and all that. Then the susceptible host is that person who is vulnerable to infection. That one who has low immunity or immunosuppressed, that one is easy to get the infection. So to break the chain of infection, we need to team up as healthcare professionals, because each person has got their role to play. If you are a doctor, you have your role to play, recognizing the infection and accurately treating it to eliminate the chance of transmission. If you are the ones dressing the wounds, you need to do the right way, aseptic technique. The one dealing with the environment, you need to clean it. You need to make it free from organism. That is the way to break the chain of infection. Now, breaking the chain of infection, we use the standard precautions. There are many, starting with hand hygiene, appropriate use of personal protective equipment, prevention of needle stick injuries and sharps, respiratory and cough hygiene, environmental cleaning, used linen processing, healthcare waste management, reprocessing of patient care used equipment or devices, isolation precaution and patient placement, healthcare, health education and patient and visitors education, and staff health is part of the standard precaution. The standard precautions are used together with additional precautions, the ones we call transmission-based precaution. This is just like asking yourself, what is the mode of transmission of this disease? Then you take your precaution. There are three: the contact precaution, droplet precautions, and airborne precautions. I want to talk about few standard precautions, and I will start with the first one, which is hand hygiene. It is the major component of standard precaution and one of the most effective methods to prevent transmission of pathogens associated with healthcare. It is done by the use of alcohol-based hand rub or use of washing your hands with running water and soap. It is simple, but it prevents 80% of hospital-acquired infection. You need to follow the correct technique for you to perform hand hygiene correctly. And we say that in the healthcare setting, you need to observe the 5 moments for hand hygiene. What do I mean by 5 moments for hand hygiene? It's that you need to wash your hands before touching the patient, before a procedure, after procedure or body fluid exposure, after touching the patient, and after touching the patient surrounding. An hospital is a patient surrounding, and a patient surrounding is not static. It could be a patient on a wheelchair, a patient being moved on a bed. That's a bed, is a patient surrounding, and you need to wash your hands after that. The second precaution I will talk about is personal protective equipment. These are devices worn by healthcare workers to prevent themselves from coming into contact with the body fluid or pathogens prevailing at the workplace. And the choice of the personal protective equipment should be guided by risk assessment and extent of contact anticipated with body fluid or even pathogens. So before you wear the mask, you have to ask yourself, what is the risk here? Is mask enough, or is glove required if your hands are going to get contaminated? And that is what guides us when it comes to personal protective equipment, because not all the conditions you'll wear the same. It will depend on the mode of transmission. When it comes to respiratory hygiene and cough etiquette, we are saying that persons with respiratory disease should apply source control, like wearing a mask to control the droplets from one's mouth. That is what we call source control, such that it does not get to the next person or even contaminate the environment. We cover the nose and the mouth while coughing or sneezing. And then if you are placing patient in an hospital who have got respiratory symptoms, you must consider at least 1 meter away from each other, including even the waiting areas and the bedside spacing. Just in brief, I want to talk about processing of reusable medical instruments. We are saying that reusable medical devices or instruments can be a source of infection if they are not reprocessed well. So the risk of transferring infection from a used instruments depends on the presence of the microorganism, the number and the virulence of the microorganism, the type of the procedure being performed. Is it invasive or non-invasive? If it's invasive, the risk is higher than non-invasive. Then the site where the instrument is going to come into contact with. Is it penetrating the skin or not? And the last part of it is one's body immunity. That also plays a part whether one will get infection or not. I'll talk about safe handling of sharps, because this is very key when it comes to caring of our patients in the hospital. And we are talking about the syringes, the blades, or anything which can pierce our skin. There is a risk. If one is using syringes, needles, it results to a risk of infection and transmission of diseases. We are talking about sharps which can cut or puncture the skin if contaminated. It can cause infections like hepatitis B, hepatitis C, HIV, among others. So we are saying take care of sharp objects as we take care of our patients. So discard sharps in sharp containers and follow the regulations when it comes to waste management. Environmental cleaning, it's one of the precautions which is very key, because once you stay in a contaminated or colonized environment, one can be sick. So we need to do friction cleaning of our environment daily, eye dusting, damp dusting, not dry dusting, decontamination of spills when they happen immediately, then decontaminate the cleaning and the air drying of the cleaning equipment, and color coding of the cleaning equipment is very key, because the mob which or the cleaning material which cleans the clean area should not be the one cleaning the dirty area. When we are cleaning, we have to consider starting from the clean area going to the dirty area. And the solution we are going to use, the disinfectant or the soap, has to be considered depending on where cleaning is being done. I want to talk about waste management, and I'll say that waste, healthcare waste, is a potential reservoir of pathogenic microorganisms, and it has to be handled appropriately, safe, and reliable. Poor healthcare waste management leads to infections and injuries. We have the steps in waste care management, healthcare waste management. Minimization of waste is the first step. This is the one which tells you that you're going to not to waste resources and not to have a lot of dangerous waste around ourselves. So it's very key, has to be considered even during procurement. You have to procure items which will facilitate minimization of waste. Segregation is the backbone of waste management. Segregation means placing each type of waste at its own defined receptacle at the point of generation. Then containment, handling and storage. Transportation, it's very important, because if you don't transport your waste well, you'll go contaminating the environment or even the person who is responsible to transport the waste. Treatment and destruction and then disposal is the last step. This can be gotten in our national policy on infection control when it comes to waste management. There are risks associated with improper healthcare waste management. One of them is transmission of diseases. We have talked about the diseases. We also have hazards from the waste, and also chemicals can be part of the hazards associated with improper healthcare waste management. Linen handling, and I'm talking about used linen in the hospital, can be a source of infection. Infections like MRSA, that is methicillin-resistant staphylococcus from the skin. So we need to prevent clean linen coming to contact with the dirty linen. Linen has to be sorted, infected linen from non-infected. Then it has to be processed with care, avoiding not to contaminate the environment, because this will expose both the patient, the staff, and the environment to infection. Staff health is the last precaution I'm going to talk about. The staffs need to be healthy if you are also going to take care of the patient. A sick staff exposes a patient to infection, so we need to observe the standard precaution. Personal hygiene is part of the staff health. Vaccination for all the diseases which are vaccinable, periodical screening and redeployment of sick staffs if they are there. So, having said that and having gone through the standard precautions, what are the impacts or effect of hospital-acquired infection? One, there's prolonged hospital stay. This goes with increasing the cost to the patient, the family, and even the hospital. There's morbidity and mortality, which is increased. Long-term disability can come with infection. Then increase of multi-drug-resistant organisms, which is now a big issue in the whole world about multi-drug-resistant organisms. There's time and man are lost when one is admitted because of hospital-acquired infection. Finance, cost, and resources are drained when a patient stays more to be treated for that infection, which was gotten in the hospital. Overworking of the staffs is there, and also medical legal issues will come with hospital-acquired infection, since the patient did not come primarily for that disease which is being treated as a second line. In conclusion, I want to say this. All healthcare workers are at risk of infection and partly responsible for spreading the infection if they don't maintain standard precautions. You need to consider every person, whether a patient or a staff, as potentially infectious and susceptible to infection. To minimize and prevent exposure to infections, we need to practice hand hygiene and use standard precaution with every patient. Be committed to infection prevention and control to maintain a safe environment for ourselves as healthcare workers, patients, and the general public. Remember, breaking the chain of infection is the responsibility of each healthcare worker. You take your part, I take my part. Each person takes their part. Thank you, and welcome.